Jamie, thank you for being here, and you have 4 minutes.
Good morning. My name is Jamie Reed. I hold a Master's of Science in Clinical Research Management from Washington University in St. Louis, Missouri. I'm a lifelong Democrat, a mom of 5 boys, and a lesbian. I'm also the public whistleblower from a pediatric gender center. I saw patients from the age of 3 until 26 and worked with nearly 1,500 unique patients. I worked in pediatric gender medicine for nearly 5 years, and I was once a true believer. What I learned is that these are interventions based on poor research, poor evidence, and poor outcomes. Last week alone, 2 new systematic reviews were published in Canada, finding that puberty blockers and cross-sex hormones have 0 to no evidence to support their use. Last night in Queensland, Australia, puberty blockers were banned for those under the age of 18. In the center where I worked, I saw directly the patients who were harmed by these interventions, patients whose mental health got worse after initiation, and patients who mourned the permanent changes to their bodies. This all started with a small group of clinicians in the Netherlands who came up with this idea to transition kids. They were seeking the children they believed would go on to have a lifetime of troubles with their sex and intervene when they were young. Why? Because the transsexuals adults that they were working with were not doing well. When they completed the first study, they found that the young people were proto-gay youth. 68 out of 70 self-proclaimed that they were same-sex attracted, and they transitioned them. Because we were expendable. We were okay to be harmed, to have our endocrine systems destroyed with wrong sex hormones. We were okay to have our fertility taken away. We were okay to have our sexual function stripped away. And then the British repeated this study. They cast a wider net, and this time they caught the proto-gay youth and the vulnerable, the children with autism and trauma, and then they transitioned them. And they hid those results because, again, this is poor research, poor evidence with poor outcomes. And then we in America caught wind, and we cast a huge net across this entire country in every state, and we pulled in whoever could be caught. And now we see this problem. We see the proto-gay youth, the vulnerable, the children with autism, with mental health concerns, with trauma, and they have all been caught in this new group. And now there's a group of primarily girls influenced by TikTok, hurt by COVID lockdowns. These are straight girls with private insurance, with caring liberal parents, and we have transitioned them all. The social contagion is real. And now the problem is clear. The girls began to realize what had been done to them. They stepped up and said, stop, this is hurting us. And we now see the global crisis for what it is, and it needs to be stopped everywhere. To all of the LGBT people listening today, and to the young people in this room who've been sold the lie of trans, you are resilient and strong. You do not need medications to change your body. You should not have to lose any body parts, risk medical harms, or change anything about yourself to be embraced and accepted. We do not have to conform to any straight people's idea of how we should look. Trans is the most homophobic idea ever considered. We were once given electroshocks to make us straight. We were once forcibly raped to make us straight, and now we are being transed. We are perfect just the way we are. No one needs to cut off any body parts to make you authentic. Stop supporting our own destruction and fight back with everything that you have.